With me today on Missouri Medical Focus is Dr. Rick Fraunfelder, Chair of the Department of Ophthalmology at the MU School of Medicine and a corneal disease specialist at MU Healthcare's Mason Eye Institute. Dr. Fraunfelder, as I mentioned, your area of expertise involves corneal disease. What is the cornea and what is its function?
The cornea is the clear window at the front of the eye. So if you take your finger and touch your eye, you would be touching your cornea. Behind that is the iris, and behind the iris is the lens. But I deal mainly in diseases of the cornea, which is just that front structure. It is the first layer of protection against flying objects and possible traumas, but what it really does is it bends light. It's the first refractive element of the eye that bends light so that light can come to a focus on your retina. A lot of people don't have to wear glasses because their cornea and their lens bend light just perfectly so that they can see perfectly and don't need any kind of optical correction for them to see 20/20.
What are some of the signs and symptoms of a damaged cornea or an issue that would result in needing some sort of medical care?
People notice blurred vision. They may see after images on letters. They may have double images of objects. They may feel like they're looking through a dirty window, or straight lines can appear skewed. Damage to the cornea could be a scar from trauma or an infection, or it could cause the cornea to be misshapen and induce severe astigmatism.
What are some of the more common disorders or diseases of the cornea that you as a physician see?
Patients get what we call corneal ulcers from wearing contacts too long or not disinfecting them properly or just having bad luck with contacts. That's common. Corneal dystrophies are common. People are born with a genetic condition that they inherited from their parents, and that's something that we see a lot in our clinics. There are corneal diseases that are related to your systemic health. For instance, if you have rheumatoid arthritis, or if you have lupus, or if you have diabetes, you can get corneal disease. And finally, there's a lot of corneal diseases that occur because of eye surgery. If you've had intensive eye surgery, sometimes the cornea can be damaged through those surgeries, and we have to repair the cornea because of that.
You're listening to Missouri Medical Focus on KBIA 91.3 FM, and we are discussing diseases of the outer eye. Dr. Fraunfelder, what is Fuchs dystrophy?
So Fuchs is spelled F-U-C-H-S, named after a Dr. Fuchs, who historically discovered this condition where the cornea would fill with fluid and swell, and that would cause blurred vision. And it's a condition where the cells that are on the back of your cornea that are supposed to pump fluid out of your eye to keep it optically clear, it doesn't pump fluid out of your cornea. The fluid collects and vision becomes very blurry. In the early stages, people don't know why their vision is blurry. What happens in the early stages of Fuchs dystrophy is that your vision's blurry when you wake up in the morning, and then when you open your eyes and as the day goes on, the fluid that has collected in your cornea evaporates. And your vision clears up as the day goes on. And then when you go to sleep, the fluid's not allowed to evaporate. It collects in your cornea again. You wake up with blurry vision, then it clears. And that's the earliest sign of Fuchs dystrophy.
What age does that begin occurring at?
That's a great question. Usually dystrophies like Fuchs dystrophy don't affect you until you're in your early 50s to mid-50s because it's progressive. You may have signs of Fuchs dystrophy when you're 20, but it's not going to affect you visually until you're a little bit older.
You do a very specific procedure that takes care of Fuchs dystrophy.
There are 3 probably that treat specifically Fuchs dystrophy. They are full-thickness corneal transplants, partial-thickness corneal transplants, and then really ultra-thin partial-thickness corneal transplants. They go by names. The third one I just mentioned is called a decimase membrane endothelial keratoplasty, and that's one of the surgeries that we brought with us here to Columbia that is not being performed in mid-Missouri right now. The vision after a DMEC surgery is much better, much sooner than it is compared to the other types of corneal transplant surgery for Fuchs dystrophy or other types of corneal conditions.
Why wouldn't you use that particular one all the time, or is it just because it's so new?
It's technically difficult to perform. Where I trained in in Oregon Health and Science University in Portland, Oregon, we were the pioneers of developing this surgery. It's a really large advancement in the treatment of corneal disease is this DMEC surgery.
Once a person is diagnosed with Fuchs, this is an option for them, this corneal transplant procedure. At what point would they need something like that?
So we recommend people correct their vision through surgery if they have Fuchs dystrophy when their vision reaches a level around 20/50. So that means they've lost 3 to 4 lines of vision, best corrected, meaning with their glasses on, they've lost 3 or 4 lines of vision when they are tested. And we think that's the threshold for doing surgery. And the surgery specifically is a surgery where we remove the diseased cells, which is what Fuchs dystrophy is, diseased endothelium on the inside of the cornea. We just gently remove that from the inside of the cornea without cutting anything. It just peels right off. And then we insert new cells from a person who has donated their eyes to science, and we transplant those cells to the inside of the patient's eye, and those cells take and they start pumping fluid out of the cornea to make it optically clear. It is a bloodless surgery. There's no risk of transmission of HIV or hepatitis or any bloodborne illness. You do not need to do blood matching. It doesn't matter what blood type you are because it is bloodless. And rejection with this type of surgery is very infrequent.
How long is the procedure?
We could do a DMEC in about 30 minutes. You're awake the whole time, and you go home an hour later, and recovery is relatively rapid.
If a listener wanted to find out more about corneal transplants or DMEC, how would they get in touch with you or your clinic?
Our clinic phone number to make an appointment with me or any of our doctors is 573-882-1029, or you could find the ophthalmology department within the website of muhealth.org.
And again, that telephone number was 573-882-1029. I'd like to thank Dr. Fraunfelder for being my guest for Missouri Medical Focus. I'm Jeff Helsher.